section that we're going to cover in this chapter would be disorders of the respiratory system. So we're going to be focusing on homeostatic imbalances of the respiratory system. Starting with the upper respiratory system. The upper respiratory system is prone to infections. These can spread from the nasal cavity to the sinuses, middle ears, and the larynx. So for example, strep throat is a bacterial infection caused by Streptococcus pyogenes that can lead to a generalized URI infection, so an upper respiratory tract infection, and it can even lead to systemic infection. So some of those symptoms include severe sore throat, high fever, and white patches on a dark red throat. It can be treated successfully with antibiotics, and it should be. If you have strep throat, go get your round of antibiotics and take care of it. Take it as prescribed. Strep throat can be very dangerous if that upper respiratory tract infection were to spread to other areas of the body. There are also things like sinusitis. This is when we have inflammation and blockage of the sinuses. Otitis media is infection of the middle ear. Tonsillitis is inflammation of the tonsils, and this can be treated with a tonsillectomy, which is just the surgical removal of those tonsils. Laryngitis is infection of the larynx, which can lead to voice loss. There are going to be quite a few lower respiratory tract disorders, and we'll go through each one of those, starting off with infections. Those infections could be anything from acute bronchitis, which is infection of the primary and secondary bronchi. Pneumonia is bacterial or viral infection. The bronchi and the alveoli fill with a thick fluid. Tuberculosis is a bacterial infection that leads to tubercles or encapsulated bacteria building up in the lungs. One thing I would like to point out is that both bronchitis and pneumonia aren't themselves diseases or sort of infections. It's what happens as a result of an infection. So pneumonia is the buildup of fluid in the lungs caused by a bacteria or viral infection. Bronchitis, again, is simply the term we give it to an infection of the primary or secondary bronchi. This is not necessarily tied to one specific infection or one specific bacteria or virus. So the next thing that we want to discuss are restrictive pulmonary disorders. Here we have a diagram. This, I think, is a fantastic diagram that kind of explains the differences between all of these different respiratory disorders. So like over here, we have an example of an alveoli that is filled with a fluid due to pneumonia. Pulmonary fibrosis is when fibrous connective tissues build up in the lungs, which reduces their elasticity, reduces their ability to expand and take in as much oxygen as needed. Here are those pulmonary tubercles, where we have encapsulated bacteria building up in the alveoli. Emphysema is where we actually see a destruction of those alveoli. So we don't have those nice defined little bubbles anymore. They start to fuse into large air sacs. Now the problem with this is that we're reducing surface area for gas exchange. So even though the lungs are filling up, there isn't necessarily a sufficient exchange of oxygen and carbon dioxide between the lungs and the respiratory and the circulatory system. Asthma is caused by an inflammation due to irritation. The bronchioles start to restrict, so this isn't an alveolar disorder. This is occurring up in the bronchioles where they're starting to constrict. Bronchitis is when those airways are inflamed due to an infection, and it causes sort of a swelling of those bronchioles and also restricts the flow of air. So like I said, there are several restrictive pulmonary disorders. Here's an example of all of those. Basically what happens is vital capacity is reduced. The ability to get air into the lungs and into the circulatory system is gone. The lungs have lost their elasticity. So like I said, pulmonary fibrosis, fibrous connective tissues build up in the lungs, usually because of inhaled particles like sand, coal, dust, asbestos, fiberglass. All of those can lead to that buildup of that fibrous connective tissue. This prevents the lungs from inflating properly and can ultimately lead to cancer of those lungs. Obstructive pulmonary disorders. In this case, the air is not going to flow freely in the airways. So like bronchitis, emphysema, asthma, those are all chronic obstructive pulmonary disease. because they tend to reoccur. They tend to be a long-term issue instead of just a temporary infection. Chronic bronchitis is when airways are inflamed and filled with mucus. The bronchi undergo degenerative changes, including the loss of those cilia. Smoking is the most frequent cause of bronchitis. Exposure to other pollutants too, though, can cause it. Things like all forms of tobacco can ultimately cause damage to lungs. It can increase the chance of lung, mouth, larynx, esophagus, bladder, kidney, pancreatic, stomach, and cervix cancers. Smoking also increases the chance of chronic bronchitis, emphysema, heart disease, stillbirths, and harm to an unborn child. And passive smoke can increase a non-smoker's chance of pneumonia, bronchitis, and lung cancer. So it's very, very dangerous to take up smoking. Emphysema is chronic and incurable. What happens is those alveoli are going to become distended, their walls will become damaged, and surface area is ultimately going to be reduced. Less oxygen is going to reach the heart and brain, even when you're taking big gasping breaths. It doesn't really matter how much oxygen you're bringing into the lungs if that oxygen cannot then pass into the body, or at least not efficiently because of lost surface area for the exchange between the circulatory and respiratory system. Is most often going to be caused by smoking. The atelastic recoil of the lungs is going to be reduced, so not only are those airways narrowed, but the driving force behind that expiration can also be reduced. Asthma. Asthma's symptoms could be wheezing, breathlessness, sometimes a cough, expectoration of mucus. When you're exposed to an irritant like pollen or tobacco smoke, the smooth muscles in the bronchioles start to spasm. Asthma is not curable, but it is treatable with specific inhalers. Lung cancer. Lung cancer is another homeostatic imbalance of the respiratory system. It's more prevalent in men than in women. The first event in lung cancer would be the thickening of the lining of the bronchi. Then the cilia start to become lost, making it impossible to prevent dust and dirt from settling into the lungs. Following this, cells with atypical nuclei start to appear in the lining. Tumor made of those cells with atypical nuclei is considered cancer in situ. Just means that the cancer is located in one spot and it hasn't started to metastasize. However, in the final stages of lung cancer, some of those cells can break loose and penetrate other tissues, metastasis. Now here's the thing. Or why lung cancer can be so dangerous. It's because although it starts in the lungs, it can quickly, because of the interface between the interaction between the circulatory and the respiratory system, those tiny little cancer cells can break off into the bloodstream and be carried to anywhere else in the body. And so that's why lung cancer is such a major concern. Is because it can quickly, once it metastasizes, it can quickly spread to pretty much anywhere else into the body. Here's an example of what can happen to a lung over time due to smoking. It's not pleasant. I really don't have much else to say other than don't take up smoking. Do not start smoking, and if you are smoking, please quit. Please make an effort. The damage that it does to the lungs is just incredible, the amount of damage that can happen to lungs in a short amount of time with smoking. All right, so that's it for this section. You should be able to name and describe the symptoms of some of the common respiratory infections and disorder. And really, you should know, what I really want you to know and understand is the structure and the function of the lungs. If you understand the structure and the function of the lungs, the disorders make a lot of sense. If what we are heavily relying on is a lot of surface area between the circulatory and the respiratory system, then loss of that surface area is a bad thing. Even if you are able to respire, even if you are able to get a lot of air into the lungs, you're not going to be able to get it into the bloodstream. And so you're going to not have enough oxygen in order to support all of the different metabolic functions. If, for example, you start to get an increase of fibrous connective tissue that's preventing the elasticity of the lungs, well, then it's going to make it very difficult to actually expand those lungs. So even if you can expand the rib cage, the lungs themselves are not going to expand enough to allow inflow of air to allow for that gas exchange. If you get a buildup of fluid in the lungs, then we're going to have the inability to get oxygen into the alveoli, from the alveoli into the circulatory system because of the blockage, the obstruction of that fluid in the way. So we focused on a lot of different disorders. Really what I want you to get out of this is to understand the structure and the function of the lungs, and that will bring about an understanding of these different respiratory disorders and how they can cause, or how they can wreak havoc with the respiratory system.